Hey, good afternoon, everybody. Eric with American Business Systems here, welcoming you to our Wednesday webinar. Today, we're going to talk about how does the latest technology improve medical billing, the business opportunity you don't want to miss. So we're going to answer a lot of different questions this afternoon on technology, how it's improving medical billing, how you want to get in on the ground floor of a lot of this, and how a lot of what you might have some myths thinking about the technology, especially about artificial intelligence, of anything else like that. You got some questions about today. We're going to help answer some of those questions. Now we're going to spend a lot of time on that, but we will touch on that briefly as we go through it. So let's give everybody a few minutes as they're coming in here. I see a few of the attendees that are here this already afternoon. I see Asher and EJ and Frederick. Good to see everybody so far. I got some other folks just about to come on in here. I know that we're starting just right up at the top of the hour, so we're going to give it just a couple more minutes. But in the meantime, if you guys don't mind, just typing in your Q&A box. If you'll find your Q&A box right there. You can find that Q&A box, or it may be in the dashboard somewhere you can find it. Just type in there. Just tell me where you're calling in from. I would appreciate it. And then that's going to be the way that you get to communicate back with me this afternoon. So again, I'm going to go back over here to the title page and then just again kind of wait for a few more folks to come on in and let some of our attendees let me know where they're calling in from. I appreciate that as we go through it. Then as we do go through today's webinar, and if I touch on a subject that you've got some more questions on, feel free to type in a question for me. Also, if you don't mind, whenever you're typing in the question, if I answer your question, either give me a thumbs up or a clap or a heart or whatever you can see there as a little emoji. That helps me to know that your questions have been answered. Okay, we've got EJ is from California. Good to see you. We've got Frederick from Florida. So first of all, right off the bat, we are truly coast to coast. I'm in Dallas, Texas area. We got Nora that just joined us here. Got a few more folks that are just coming in here, and then Asher, if you don't mind typing in, let me know where you're from there. That'll be awesome. And like I said, we got some other folks that are coming in and just getting here started. All right, again, here's the Q&A box, so that's where you get started right there. If you've never been on one of our webinars and you've never met me in person, my name is Eric Auger. I'm the Director of Learning and Engagement here. Nora's from Elgin, South Elgin. So good to have you here. I am the Director of Learning and Engagement. I did actually see on my LinkedIn page that just celebrated 18 years with American Business Systems. So to say I've been here for a little bit of time is to say the least. Asher's from Chicago. It's good to see you. Appreciate you joining in there with me. But I love doing what I'm doing here. I've been doing this, like I said, along with the Phillips family for a long period of time. I was introduced, obviously, to American Business Systems a little over, I guess, 19 years ago, almost going on 20, and then spent some time in just doing my due diligence to let you know that I have owned 2 medical billing companies through American Business Systems. I've moved on to a couple of other healthcare industry type still. I'm still in healthcare. Matter of fact, I was working with some nurse practitioners today, the last few days, on how they can increase their cash flow. So folks, I'm in this all the time. And so I'm always looking at ways for doctors and nurse practitioners and other providers that they can see where they can make more money as they go forward. All right, so today we're going to talk to you a little bit about American Business Systems as we get started. Some of you may have attended our Wednesday webinar that we did last week. If you haven't, I'm going to show you where you can find that on our YouTube channel. I did an interview with Adam Phillips. We talked a little bit about the future of medical billing, but really the future of medical billing with inside of American Business Systems. He has written some articles that have been published in the Billing and Coding Advantage magazine. You're going to want to get a hold of a few of those. One of them is on the shrinking private practice and why medical billers' expertise can be a lifeline to these providers. I'm going to share a little bit about that today. Back in 2024, there was an article that he answered the question, will AI take over my job as a medical biller and or coder? I think you're going to find out today that we've answered some of those questions, and we'll go through that as well. He's also co-authored a book called 9 Ways Doctors Let Money Slip Through Their Fingers. He co-wrote that with Dr. Vicki Rachner. About 2 to 3 weeks ago, I interviewed Dr. Rachner. So there's a couple of interviews that you can certainly look into about saying, hey, I'd like to hear from some of these folks. Matter of fact, I believe it is next Wednesday, March the 11th, we're actually going to be doing an interview with a guy by the name of Rupert Vasquez and Maria Toro. They've been doing this for just a little over a year now. They're going to share their story, their kind of where they are with everything. I think you're going to not want to miss that one if you haven't already made your decision to join us. So again, March 11th, we're going to be dealing with another interview. But also, getting back to Adam, he is also the founder of an organization, of a group called MIRMA. MIRMA is the Medical Revenue Management Association of America. It is this organization that was founded by Adam that will certify you as a certified medical revenue manager. Sorry, it's been a long day. I've had a lot of conversations today, but it is put out by MIRMA. You will be able to carry the MIRMA logo on all of your marketing material and everything else that you're doing. So it's a great organization. It's been around for a little over 10 years now. So very reputable organization. You'll be a part of that. There's a lot of things that comes out of MIRMA, even additional training. We not only do you get your initial training here just to get things started and kicked off, but there's actually, MIRMA has developed a new, more advanced some more advanced training there. So if you want more information about that, you can certainly talk about that to your sales rep. All right. So today, without any further ado, we're going to talk about how does the latest technology improve medical billing. Now, we're going to talk about everything from cloud-based the software, obviously artificial intelligence, to some of the EMR stuff that's out there, some of the great opportunities that are still out there coming, some remote patient monitoring. So those are just some of the little bitty things that we're going to be talking about. But first of all, what I want to address with you is we got to identify the problem. What are some of the problems that the doctors are facing? Now, I'm going to be sharing some news articles with you that you'll find here in, on any of my slides today. If you feel like you'd like to take a screenshot of it, feel free to do that. Or if you'd like an entirety of the slide deck, you can get back with your sales rep. We'll get you a copy of it in a PDF format. But the first thing is, let's look about the problems every doctor faces. Well, from Pluritis Health, this organization does a lot of research, a lot of type of background. Again, there's their website down there, so I'm referencing them directly. But healthcare organizations lose 5 to 15% of their annual revenue due to improper accounts receivable management. So folks, that's just one aspect of where doctors are losing money. A lot of times we think that the doctors are losing money because of, I don't know, they're just not being billed. And sometimes that is it. But according to the Medical Group Management Association, that's MGMA, they did a survey that the average accounts receivables percentage over 120 days is about 13.54%. Now, folks, let that sink in a little bit. Not only are they not getting paid, but they're only getting paid about a little bit. And it's taken them a long time for them to get their final payments. So as you can see, it says this blog will give you information about tips, benefits, and the importance of AR management. So I encourage you, again, if you want to take a screenshot of this, go out to their website there and see this post. This is an incredible post. But folks, we started off this, we're just trying to get the understanding of what are doctors struggling with. It's just, this is one of the problems. The next one I'm going to talk to you about is claims denial management. But this is just money that's been billed already. It's just waiting to be paid, but for some reason, it's not getting collected. Over 120 days. Folks, we here at American Business Systems, we can prove to doctors and show doctors by utilizing our EMR system, our iClaim-based system, and it's a web-based system. It's not server-based. I'm going to talk a little bit about that today. That they won't ever deal with 120 days of money that's just waiting out there for them to be paid. We're getting doctors paid sometimes with as early as 5 to 7 days, but really no more than 14, not 120 days. So this is one of the big problems that doctors are facing. There's another group out there called William Blair, and in their article, and you can see it's AI and the Future of Healthcare Billing, a breakthrough for providers and investors. Now look at this. In their article, and I'm going to go back to a couple of these throughout the presentation today, but another issue is claim denial management. Now, that means that claims have been posted or billed out, but for whatever reason, they get denied. They either get denied at a clearinghouse level or they're going to get denied at the insurance level. Okay. But you can see here, now these are not numbers that are coming from American Business Systems. These are coming from people that are actually doing surveys, and we just kind of rely upon their information. But more than 15% of provider pay claims are initially denied. Now, again, let that sink in. That means 15 out of 100 claims that the doctor is billing in a day's time, that they're only going to get paid on 85% of those. Now, that's if nothing else goes wrong. This is just typical right off the top. And you're thinking, well, gosh, 85% is better than nothing. Well, who wants to have just 85% of their salary? Nobody wants that. So 15% of claims are initially denied. Now, we know on the back end that even if when a claim gets denied, only 50% of those get reworked. So over a period of time, there's an issue that happens there. However, AI provides a proactive solution by predicting and preventing errors before submission. Who is that telling that to? It's telling it to some biller, which you're going to find out that our claim system already has AI built inside of it. So it's going to analyze historical data to flag potential issues and can even automate appeal letters, making it easier to overturn denials and recover lost revenue swiftly. I encourage you, again, in your due diligence, take this information down. This is brand new information. A lot of this has just been posted within the last 15 to 20 days. So these are brand new articles that have come out here. Again, I'm going to go refer back to William Blair here again a little bit later on in our presentation, some additional solutions there that is very important to you. But if you're doing your due diligence here, folks, one of the things you have to look at is where are the doctors losing it? Well, they're losing it on their AR. They're losing it on claim denials. And then another area is just administrative costs themselves. As you can see here in health tech, AI Healthcare Administration, a complete overview, which again, this is an incredible slide that you're going to want to take into consideration. But administration makes up roughly 25% of healthcare cost. That's a lot of money. So whenever you are out there and you're looking to get into this business, you're going, why would a doctor ever use me if they already have a biller in-house? Hopefully I just helped answer that question, because about 25% of administrative costs goes into billing, and that is because they are billing in-house. If you do the billing for a doctor, typically you're going to bill and get reimbursed on anywhere from 5 to 9% of what's collected. So we're talking here, you can almost reduce their overall head cost off the top nearly 15% right off the bat. Okay, so just again, I'm sharing some information to you just to give you some fact information that you must consider as you're thinking about why would I ever get into this business in the first place. These are the reasons why you would want to get into this business. I think that slide was in there a second time there. So what you need to get, again, it goes on to say the overall healthcare spending reached $5.3 trillion in 2024, which means administrative costs toppled $1.3 trillion. If organizations are looking at cost containment, administrative is one area of opportunity. So if you are looking for the opportunity to get involved in medical billing, this is one of the reasons why. Because if a doctor is doing billing in their house, we can show them through a practice analysis that their administrative costs can get to and or exceed about 25% of their healthcare costs altogether. Okay, so I'm just giving you some information here just for you to have food for thought of what is the issues that doctors are facing. So if you've got any questions so far, feel free to put those in a question Q&A box, and I'll help answer some of these questions here. But really, before we get into dealing with what's going on with technology and how it's actually fixing those problems, we got to figure out what those problems are in the first place. So again, let's review those before I go any further. Accounts receivables, over 120 days of money sitting out there. That's their money. They're not collecting. Denied claims is number 2. The exceeding a number of amount of denied claims that can be fixed by technology. And then lastly, the administrative. This is the people cost. This helps answer the question to you, why would a doctor ever use you if they already have a biller in-house? We have a spreadsheet and a questionnaire called a practice analysis questionnaire that will help uncover these administrative costs that's really costing the doctor more money to have somebody in-house to do their billing as if they had it outsourced. So for everybody that's on the call today, everybody that's listening to me on this recorded call, you've got to put off your worker's hat, so to say, and put on your CEO hat, your chief executive officer hat, or your chief operating officer hat, or your chief financial officer hat. You've got to understand that hopefully the people that are on here today and the people that might listen to me a little bit later on a recorded call, that hopefully I'm having a communication and dialogue with people who know that they're going to be owners of their business. You're not just coming to us to get training just to become a medical biller so that you could go work in a doctor's office. This is an opportunity for you to have a business opportunity to work from home. We think right now in 2026 is one of the greatest times and opportunities because of the new technology that's out there. So my question to you here really is, what if technology could fix all of this? And I can tell you every bit of it can be fixed now with the new technology. Okay, so we're going to dive into that already, and we're going to start holding the next 10 to 15 minutes and just review some of the things that are happening in the billing industry in 2026. You've got a great opportunity again here. American business systems wouldn't be here 30 plus years if we weren't keeping up with what's going on. I can remember back when a lot of doctors' offices still had server-based type software in their office. And I remember dealing with that as trying to get doctors to move from a server-based system over to a web-based system. Now, it's not that as difficult as it used to be, but there are still doctors out there that are still tied to a server-based system. Matter of fact, there is even an organization out there that is a medical billing opportunity that their sole purpose of their software is a server base that can be accessed remotely. Ours is 100% cloud-based. Every time that you open it up, if there's something new that needed to be fixed or a bug fix that needed to be patched, something's already been fixed there. And it keeps us with all the new codes. And then now with the onset of artificial intelligence, all of our primary sources of the iClaim platform has access to a lot of the things that we've dealt with so far. All right, let's move on. So let's see what's going on with AI. Folks, y'all know this better than I do probably. Some of you are probably in it a lot more than I am in, but we know that AI in medical billing market is huge. It is growing exponentially as we are just moving forward. Now, again, we are in 2026. In 2025, it was at $4.7 trillion, or sorry, $4.7 billion in 2010 to 2025. It is predicted to increase to $5.9 billion in 2026, which is where we are right now. Approximately US dollars again, and then to start to exceed $45 billion in 2035. So if you can see this is a continual aggregate type of growth return of 25% from 2026 to 2035. And folks, if you think about it, you're going to want to be, if you're going to get into a business opportunity, you want to be in a growth channel, a growth market out there. I know you're probably looking at so many different things out there in the market, and there's some great franchises out there. There's some really great business opportunities out there. There's some things that you can do to work from home and probably make a decent living at it and be okay with it. But I don't think I've seen anything that has the growth in the healthcare industry with other organizations as we see here with healthcare. Because once you get into this, as you will talk to, if you'll take the time and get back with your sales rep and say, you know what, Eric mentioned that I can talk with some of our current business owners that are in medical billing with American Business Systems, you will find out that they're doing much more than just medical billing. They find themselves at the doctor because you become a trusted consultant. And I think that's one of the things that we sometimes rob ourselves from as we're trying to figure out, what do I want to get involved with? Well, I'm trying to hopefully, again, I'm talking to a group of serious CEO-minded type people who want to own their own business. Now, you may do most of the work in the beginning, but you're thinking about, hey, there's a growth market here. I want to grow with this growth market. There's going to be some great opportunities that even some of the established medical billing companies already out there don't have. I can tell you that the doctors don't have time to keep up with the AI-driven automation growth that's happening out there. They're just doing what they can to survive. Remember, I've already said that doctors are having trouble just collecting on their accounts receivables of 120 days plus. So, folks, this is something that you're going to really need to pay attention to. All right, the medical billing industry in 2026, healthcare does not pause during economic uncertainties. Whatever's going on at any given time, providers still need to treat patients, insurance claims still need to be processed, and revenue still needs to be collected. So the bottom line to this is truly, this is one of those businesses that is a recession resistant with it's a high growth industry. So this is what you've got to understand of what you're getting involved with so far here with American Business Systems, or just in general in healthcare. You will find out that a lot of times when you start to do billing for doctors, when you bill for at least 1 to 2 doctors, you're going to be finding out that you make more money than most doctors do, and you're spending a lot less time doing what they do. Okay, most doctors are making $200,000 or more. With 2 to 3 doctors, you can be making $150,000 to $175,000. So you can be getting very close to what they're making already, and then exceed that with 3 to 4 types of doctors. Now, in a couple of weeks, I'm going to be going over as another topic of really how much money you can make here. We'll dive into those numbers and show you how all of that works. But just to let you know that the possibilities that are out there, even if you had one doctor that was providing income for you that kind of had a minimum of about $50,000 of return for you per year. Again, if you had 3 of those doctors, that's $150,000. But there's opportunities to always make more. And I'm going to show you even today where I think a lot of doctors are leaving money on the table with their coding. The advancement of AI is actually going to help with that. And so there's a lot of great things that are happening out there. All right, technology. It's technology number 1. So this is all about how does the latest technology improve medical billing. First of all, ABS has always been in advance. We always felt like we've been on the cutting. Patrick Phillips used to say, we're on the bleeding edge of technology. And so we've always been cloud-based for a long, long time. Matter of fact, as long as I can remember, we've always had some type of cloud-based system. And it's advanced from the day one that I was here 18 years ago. But I'm telling you, we made a big change about 13, 14 years ago when we teamed up with the company now that's called NextGen, and they supplied all of our billing platforms for us. It's just unbelievable. But what are the advantages of that? Everything is accessible from any device. It doesn't matter if you're running from a PC, you're running it from a Mac, you're running it from an iPad, you're running it from an Android phone. It really just doesn't matter, because everything you'll be able to do is going to be in real-time cloud claim submission. Think about it, is if you had a server sitting somewhere over in the corner of your office over here, you have to have that hooked up to an internet. But what it does, it goes over there, and then at some time of the night, whenever you've hooked it up to your clearinghouse group, that they take batches ever so often. So then you batch everything up, and then once it gets to the clearinghouse, then it does its processing. And it may not be till tomorrow or the next day following that you may find out that some of that batch has errors in it. And it used to be the whole batch would come back. Nothing would go through. Imagine that. Let's say that you did 25 claims and you had a couple of those claims that had errors in it. The whole batch would come back. Now, it's not like that anymore. Only you get back just the denied claims. Now, at least with our software, when you're doing real-time claim submission, every time that you produce a claim through our system, our cloud-based, web-based type system, it's immediately going through the clearinghouse at the same time. And immediately you will know whether that claim is going to be denied or accepted in real time. And if it's denied in real time, at least you can fix it in real time. You don't have to sit there and wait for it and then you fix it to where it's going through. So imagine processing 25 claims for each of your doctors. And by the end of the day, 25 claims have gone through as a clean claim, and none of those have been denied. Remember back earlier, we kind of addressed that, how many claims are being denied. And, it could be up to 15% of the doctor's claims for that day. And if they're billing 25 claims, well, that's 4 to 5 of those claims. So they're only getting paid on maybe 20 of those claims. And you keep adding that over a day's period and a week's period, and then obviously a month period. You're talking thousands of dollars of not being paid on something. So real-time submission. and obviously it eliminates paper claims and manual filing delays. And again, we've been away from that for quite some time. There are a few times where claims have to be filed on paper claims. It's still like that with a few payers like that, but it's very, very few and far between right now. But what does this mean for you? I believe, again, as we are going through this and everything that we're going through with healthcare technology, that you still have an incredible window of opportunity to help some doctors that are still on server-based type systems and move them to a web-based. That is still going on. Then the other opportunity is now with the advent of artificial intelligence. Now, gosh, what's the new opportunity that lays before you with everything else going ahead? So there are some great opportunities. Okay, technology number 2, and this is where hopefully everybody that's here has been concerned about artificial intelligence and automation here. All right, so again, if you've got any questions about artificial intelligence, now's a great time to ask me these questions, but hopefully by what I'm presenting to you today kind of helps you kind of go, okay, I get it. It's not anything against me. It's actually anything against anybody else that's out there, because I'm going to tell you, there are medical billing companies that are already learning how to utilize artificial intelligence in medical billing. You can go into certain areas on the web, specifically for artificial intelligent coding, medical coding. And I'm telling you, folks, from the day that I started, I didn't have a clue what a 99214 or 99215 was, or any of the other codes, or, extension codes or modifiers or anything else like that. Now it's just a click of a button. You just go in there into ChatGPT or any of these other type of platforms that are out there and say, hey, I'm about to build this for this doctor. Are there any modifiers that are supposed to be with this? And it looks it up and it'll tell you, and you can get that fixed. A lot of times, even in our own systems, it helps alert you of what needs to be done. So folks, we've come a long way, and this is a great time to be in this. Now, remember, I shared with you earlier that partly from another article that we had earlier, is that from Health Tech, we kind of AI in healthcare administration, a complete overview. Again, I would encourage you to go to this website here. You can see where that website is there. If you want, again, take a screenshot of this. You can get this right now, and or again, get the slide deck from your sales rep here. But look what it says here in this article: billing, claims processing, and RCM automation. RCM is revenue cycle management. Let's read it together. Automated coding tools can analyze data in the EHR and other clinical systems and assign the appropriate diagnostic and procedure codes. Folks, this is where it's at. This cuts down on the time it takes to properly code a patient visit. Claims can be submitted faster, which means organizations get reimbursed faster. Go find this article. You can see that it came out January the 22nd, 2026. So just a little over a month away ago, this article came out. I'd get it, read it. The whole entire article is incredible. It'll help you to understand some of the issues that doctors are facing and the solutions that AI is bringing into healthcare administration. Now, remember, William Blair and them talked about the cost of what it talked to about the high cost of healthcare administration. It was up to 25%. Imagine it going to you, and then you're only charging the doctor 6-7%. You've already brought the administrative costs down to at least 15% already. So you're already saving the money, which means that there is actually more cash flow into that doctor's office. Then you're getting the doctors paid exactly what they need to be paid. Frederick is asking, are there different AI engines for different specialty areas? Yes, you can go look at those, but I tell you, the onset and the advent of artificial intelligence, we're finding that our own medical billing companies are using ChatGPT and some of these others, but there's some very specific healthcare type of AI chat rooms that are out there that you can go find this stuff. But again, you got to rely upon the iClaim system itself. The iClaim system itself has a lot of this already in it. So here's an encouragement that I encourage everybody on here today. If you haven't had a demonstration of the iClaim system yet, then I'm encouraging you to get back with your sales rep and let them show you and kind of give you a tour, a look around, to show you some of the, outside of AI, some of the great things that the system already does in the first place. Okay? Good question there, Frederick. I appreciate it. All right. I mentioned William Blair, this organization here. Again, this article, AI and the Future of Healthcare Billing, a breakthrough for providers and investors. I think that you're an investor because you're investing in a business. You're relying upon a new technology out there, but listen to what this says. And remember, RCM stands for revenue cycle management. All right, so let's read this together. Revenue cycle management tracks the financial process from patient registration through final payment. Okay, let's just pause there real quickly. So you can see the financial process. Where does it begin? I'll wait here for someone to type it in. I just want everybody to recognize where the financial process of a claim begins. Anybody can type it in there for me, like a little audience participation. Just read it. Financial process from where? Where does it begin? All right. Yes, from the patient registration. Okay. From patient registration, that means the time that patient walks in the door. You know, every time that you walk in the door, they say, hey, can I see your driver's license and insurance card? Why do they need that? Because they need to verify that you are eligible to receive benefits from that insurance company. Let me tell you a quick little secret here. Our iClaim system will allow you as a medical biller to put that information inside the system and verify insurance for that particular patient at that specific time of the day or the year. Because, you know, some expire, some have had some others that expire. But if imagine that you collect all the data, the patient is being seen by the doctor, someone processes that claim. So everybody, somewhere along the line, someone has gotten their salary. You know, the doctor has seen the patient, and the only person not getting paid is the doctor, because their front office did what they did. They checked the patient in, they put in all the information data in there. The biller billed it out. They got paid, but the doctor didn't get paid simply because someone didn't check or verify the patient's registration. So let's read this again. Revenue cycle management tracks the financial process from patient registration, which is part of revenue cycle management, through the final payment, involving coding, authorizations, and compliancy requirements. Historically, these workflows relied on large administrative teams or outsourced vendors, leading to delays and high cost. Estimates suggest that the industry could save more than $18.4 billion annually with automation. AI is stepping in to address these inefficiencies and redefine how RCM operates. Okay, you need to be a part of that process, because the more money that you can help the doctor save is the more money that they get, the more money that you make. Okay. Again, I encourage you again to go get this particular article and read this. Another one from High Tech Billing and Claims Processing Automated Coding Tools. I think I already read that one there. I think that one was already there. So let's look here real quickly. So technology number 2, what are the results? Obviously, faster payments, fewer rejections, more revenue for the doctors. Okay, that's what technology can do. Okay, lastly, number 3, the technology number 3, telehealth and remote services billing. Okay, so this is really, really cool, because this is something that actually came out. It really had its genesis during the COVID pandemic. Now, we know that the COVID pandemic was a bad thing, but out of what happened out of there is people got you couldn't go see your doctor. So they had to make a way to go see your doctor. So really the birth of telemedicine really, really came out of that. And not only that, remote services happened. Okay. And what is remote services? This is where there are devices out there that are actually part of American Business Systems service line of services called remote patient monitoring, that doctors can take blood pressure, and the patient can take their blood pressure at home, and it remotely being sent to the doctor's office without the patient having to write it down and tell the doctor anything. Same thing with glucometers. If they need to take their blood sugar, they take their blood sugar, it automatically remotely services that information to the doctor's office. So it's like being at the doctor's office and they're reading it, and if there's something that's out of range, the doctors and themselves will know that before the patient even knows. So again, how does the latest technology improve medical billing? Number 3, telehealth. So look at what this says. This is from an article from Global Healthcare Resources. And again, I've got their place right here for you. You can go look that up. It says here, in the 2026 CPT code update reflects a growing shift towards digital health services like shorter duration, remote patient monitoring, and AI services that augment physician capabilities and improve patient care. All right, so you need to get on the front edge of this, okay? As far as we know here at American Business Systems, we are the only business opportunity in medical billing out there that actually has remote patient monitoring as an additional service that you can provide doctors, which actually increases their cash revenue, okay? As AI and tech-driven services continue to expand, providers will be able to identify warning signs of underlying health problems, manage chronic diseases, monitor post-acute care, and enable highly personalized treatment plans. Question: how will your organization leverage current trends in the healthcare industry? That is, increase adoption of digital health services to promote quality care, positive outcomes, and lower cost? And how will you ensure your billing team captures all the appropriate revenue by accurately reporting new and emerging codes? I couldn't have written the better for American Business Systems. It was almost like this whole article was written with ABS in mind and with you in mind, because this is what you're going to be able to capitalize upon. So again, the opportunity that you have here is to, number one, help smaller practices who still don't know how to capture this revenue. Okay? That's one thing. And then ABS licensees can bill for these telehealth services. So not only are you going to be able to bill for in-office visits, you'll be able to bill for the telehealth services. So if the doctors are reading all of this information out there, this is what the doctors are going to, you get to be able to bill for. So you can, hopefully you can see here that I'm throwing this net out here to hopefully have given you some new insights and some new information that you may not even have thought of whenever it comes down to healthcare technology. So why small practices are so vulnerable? Okay, so here's why. Because large hospital systems have a boatload of money and they can adopt this information, electronic billing, so much quicker than doctors' offices can. So independent physicians and small clinics, specialty practices is going to be your target market. So don't worry about big hospital systems. That's a completely different type of billing altogether. That's a UB04 form. It has to do with a lot of different things we won't even get into this afternoon. We really just don't have the time. Just know this, that if a provider, a small practice, a small clinic, any of the specialties providers that are out there, and I'm including the specialties that we talked about with Adam last week. We're talking about those that are licensed social workers, chiropractors, those that are in the mental health industry, dealing with that area. Some of the other smaller, what we kind of call low-hanging fruit, people that work for themselves, nurse practitioners that work for themselves. These people need your help. They don't need to go, they can't hire their own medical biller, but trying to find the right person to do their billing is very difficult for them to find. So this becomes your target market. And then they need the technology, but don't want to manage it themselves. They know the technology's out there. Some of them are trying to adopt it by themselves, and they just don't know where to turn. Okay, so these are some of the advantages that gives you this wide open window to say, yes, why wouldn't I even consider something like American Business Systems? So again, this enters American Business Systems. Again, not only do we have a 100% money back guarantee, which I'll share with you a little bit. Again, let's just talk facts here. ABS was founded in 1994. That's 30 plus years as America's leader in medical billing. We have the most comprehensive toolbox of revenue cycle management solutions on the market today. No doubt about it. Like I said, now, and these are some of the other areas I didn't even touch on. So if a doctor's office runs into some type of HIPAA issues, they've had some type of HIPAA violation, we've got Compliancy Guard that can help them make sure that they get all of that back into consideration. I've mentioned just real briefly the remote patient monitoring part of it with all these devices that you can get to doctors, and you can make a little bit of money on top of that. But really, where the money you're going to make on that is when you do their billing for that. We have 3 different types of medical billing platforms that all carry the iClaim platform name. It's just dependent upon which one works best for that particular doctor. If the doctor wants to continue to keep using their system, there are some other opportunities out there that have AI-driven opportunities out there. Adam and his team are adding more services to the bottom line, so the toolbox is still growing here. The third thing is that we're not a franchise, so that means that there are no royalty fees, there are no territory restrictions. So if you're in California, some of you, and some of you are in Florida, you may end up knowing somebody that's in one of your states. The first doctor that I ever landed as my first clinical doctor that I did, it was a urologist group. I'm here in Texas. They were actually in Georgia. I did everything remotely except for the sign-up sheet. I actually flew out there to be out there with them just one day, met with them, got to meet their team, let them know we'll do everything else remotely. I've got the signature of the doctor, picked up my startup check from them to get things rolling. and we got it going. So you don't have a territory restriction. You're not tied down to a zip code or anything else, or even your own city. My second doctor wasn't even out of my own city. It was 3.5 hours away from here. So you can see here, this is opportunity for just about anybody, and you own the business. ABS gives you the technology. So this is not like some semi-marketing network scheme here to where you're part of a pyramid type of scheme here. You are the owner of your own business. That's why I mentioned earlier, I hope I'm talking to a group of CEO mentality type people. You are the owner of your own medical billing company. As you'll hear on our testimonial that we'll have next Wednesday with Roberto, you're gonna hear he owns it 100%. He had a one-time investment. There's no other fees that goes back to ABS. There's no royalty fees. There's no franchise fees that he's going to have to pay for long term. Now, I will say this, that there are different subscriptions that go along with the iClaim platform, but that's not a franchise fee. That's not a royalty fee. That's a usage fee that doctors are already accustomed to utilizing already. They're on some type of Athena Health system or some other type of cloud-based system that's out there. They're paying some type of monthly fee. It's a wash at this point, so don't worry about that either. So but I can tell you for you and your business and the outgo of money, there's only the one-time fee for you. So the question really comes down to, for you and for anybody else, who is right for this business. I've got a few things here that I share with you. I think someone wanting to have a legitimate home-based business with flexibility. I love to hear what Patrick used to say. Patrick would always say, this is a very clean business. You're not having to carry inventory. For those that have been serial entrepreneurs out there, you've gone from one thing to the next thing. You've got hats, you've got all notepads and everything else, or books that you've tried to sell, or dishes or knives or whatever else that's out there in the multi-level marketing world out there, which some do very well. I mean, I've got some folks that have done very well at essential oils, and that was just not my thing. I just wasn't ever into that to where I could feel like I could make a decent living out of. But this I could, because this is something that was mine. I didn't have to rely upon some other company to make sure that I got the equipment from or the supplies from. This was my business. It was a clean business. It was business to business. This is not business to consumers. I know that billing was always going to be there because people are always going to see the doctors. So again, who is right for this business? It's someone that has that kind of mentality. People that have sales, healthcare, or any administrative backgrounds. Now, this doesn't exclude anybody else that has never had sales or healthcare or administrative backgrounds. We've got so many different people from all walks of life. Matter of fact, you'd hear from a testimonial from one of our guys here at American Business Systems, Tim Warren. Tim Warren actually is part of our support team now. But he came in, he's still doing billing for his particular company. He owns his own company, but he does a lot of support here for American Business Systems. But he started off here. He actually the guy has a degree in marketing, and he thought, well, gosh, I've done marketing before. I've been in sales before. This thing can't be that hard. Come to find out that everything he tried to do based upon stuff that he already knew didn't work. And we just told him, do what we tell you to do. We can take care of that. Those of you who look to replace a salary or build a supplemental income, like I said earlier, 1 to 2 doctors. One doctor can usually, on average, generate about $45,000 to $50,000, maybe a little bit more, depending upon the specialty of that particular doctor. So just using that as a rule of thumb. You don't know if you need 2 doctors, 3 doctors, 4 doctors, depending upon what you need to do. I will tell you this, that to do billing and do everything that needs to happen revenue cycle management wise, usually averages takes you about 2 hours per doctor per day. So you can see that with 2 to 3 doctors, you should be able to knock that out within about 6 hours every day, which, that's a kind of less than an 8-hour day, and that would make you a little over $100,000 fairly easily. Anyone who can follow a proven system. This kind of gets back to my story with Tim Warren. Tim came in, he thought, hey, I've got sales background, I've got a marketing background, I know exactly what I need to do, and things just didn't work that well. But we go, okay, just get back to what we taught you to do. And if you enjoy helping others, you're going to find this to be helpful. But then, and lastly, you have to have zero experience in medical billing. ABS provides everything that you need to know. So technology, I'm telling you, is transforming medical billing. The question is whether you're watching it happen or profiting from it. So the future of medical billing is web-based, AI-assisted, cloud-powered, and ABS puts that future into your hands. We think that we have everything wrapped up here. As things keep coming up on board for us, it's new services that come about. Folks, we're here to help you grow your business and to make you to be the best that you can be utilizing the latest technology. So I only had, I think, one question from Frederick. Excuse me, let me take a little drink of water here. Apparently, I've covered a lot here for you, and hopefully it helped answer a lot of your questions. Oh, here comes several from EJ. All right, so you've got 4 questions here. So let me kind of read through these and see how I can answer these. And then learning the coding side of the business if we want to do. Okay, yes. So EJ's first question is, do you have materials in learning the coding side of the business if we want to do the coding ourselves? And the answer is yes. We have a service that's called CodeWrite and another service that's called Audit Guard. They kind of work simultaneously together, but it is a coding service there. So EJ, if that's something you want to do, you certainly can do. You say owners of hospice, home health, and wound care providers, DME companies. Would I be able to work with them as their biller? Absolutely. They're billing on what's called a CMS 1500 form. I know that hospice does it. I know home health does it. I know that wound care groups do. DME companies do. Matter of fact, Patrick and Linda Phillips started their business in medical billing doing DME billing. Number 3, are all these technologies discussed already in place and active for us to benefit from? Yes, they are. And number 4, what is the usual monthly expense for a new medical billing company and approximately how much? The expenses are going to be varied a little bit. And the reason I say that, because there's a couple of ways that you can do your expenses here. But if you are, and as I mentioned, EJ, which you seem like you're really paying attention, so I appreciate it. There are the iClaims systems and some of these other systems that we have some type of monthly subscription to them. So either one way, a couple of ways that it can be done that way. You can have the doctors pay for those in a separate line item in an invoice, which some of our billing companies do that. I didn't do that. What I did, I baked in that cost into my percentage. Hopefully that made sense to you. So I knew that if at the bottom line, I knew I wanted to make X amount of dollars from this doctor, and then I added in any additional costs to utilize those services. I added it as a percentage, collected that, and that was part of my expense there, but I was being reimbursed from the doctor first before I had to pay the bill. So your expenses should be fairly low to what you're going to be dealing with on a regular basis. Again, there's no monthly royalty fees or franchise fees, so there's really not much. If you're operating out of your home, probably everything that you have already you're paying for anyway. It's just depending on how you want to reallocate that on a spreadsheet and how you want to work that with your CPA. Just figure that out, because if you can shift that from paying it out and not getting a chance to write it off, but now you're in the business, now you can write a portion of that stuff off. Now it becomes more an asset instead of a liability. Okay. Good question, EJ. Those were 4 great questions. Really, very, very good questions.